Ozempic, Semaglutide, is a GLP-1 receptor agonist approved for the management of type 2 diabetes mellitus and obesity. It acts by mimicking the incretin hormone GLP-1 and exerts effects on multiple target organs. In the pancreas, it enhances glucose-dependent insulin secretion from beta cells while suppressing glucagon release from alpha cells. In the stomach, it delays gastric emptying and reduces postprandial glucose spikes, while in the brain, it promotes satiety, decreases appetite, and lowers food intake. These combined actions result in reduced blood glucose levels, decreased hepatic glucose output, and weight reduction, making semaglutide beneficial in both diabetes as well as obesity. Thus, FDA approved semaglutide for type 2 diabetes mellitus in 2017, with proven benefits in glycaemic control and cardiovascular risk reduction, and in 2021 for chronic weight management in patients with obesity whose BMI is greater than or equal to 30, or overweight whose BMI is greater than or equal to 27 with at least one comorbidity. Therapy is initiated at 0.25 mg subcutaneously once weekly and titrated gradually to minimize gastrointestinal intolerance. The most frequent adverse effects are gastrointestinal, including nausea, vomiting, diarrhea, constipation, and abdominal discomfort. More serious risks include gallbladder disease, renal impairment, and, rarely, medullary thyroid carcinoma, MTC, which carries a boxed warning. It is contraindicated in patients with personal or family history of MTC, multiple endocrine neoplasia type 2, MEN2, severe gastrointestinal disorders such as gastroparesis, and hypersensitivity to the drug. In clinical practice, the advantages of semaglutide include effective glucose lowering, significant weight loss, and cardiovascular protection. However, its limitations include its injectable route of administration, except for ribelsis, which is available orally, frequent gastrointestinal side effects, potential risk of pancreatitis, and relatively high cost. To summarize, although Ozempic, semaglutide, has demonstrated significant benefits in both glycemic control and weight reduction, it should not be considered a first-line option for weight loss in the general population. Lifestyle modifications, such as a balanced diet, regular physical activity, and behavioral interventions, remain the cornerstone of obesity management. Pharmacological options, including semaglutide, may be considered in patients with obesity whose BMI is greater than or equal to 30, or those who are overweight whose BMI is greater than or equal to 27 with associated comorbidities, particularly when lifestyle interventions alone are insufficient. Importantly, the decision to use Ozempic for weight management should be individualized, with careful consideration of its benefits and potential risks, and should only be undertaken under the guidance and supervision of a qualified physician.